Okay, so welcome everybody. Thanks for joining us again for another podcast. And today we'll be talking about IVF, right? Or about what IVF is and what is the church's stand on IVF. So today we have two special guests to share with us more on their expertise. We have consultant gynecologist and obstetrician Dr. Douglas, who works in private practice, and we have someone who's no stranger to all of us, Fr David Garcia, Dominican priest, moral theologian, and spiritual director for us at Catholic Medical Care. So welcome, Dr. Douglas and Fr David. Okay, I hope you all are good. I'm going to be firing you all some questions. Hope you all are ready, alright? Okay, maybe Dr. Douglas, maybe you could just start us off. Maybe you could explain to us about IVF, about its safety, and what it entails actually for women.
Okay, IVF is in vitro fertilization. So essentially it is fertilization of an oocyte or an egg by a spermatozoa, or we call it sperm, outside the human body. Okay, it involves a series of steps to get there. So these steps, firstly there is a stimulation step to try and stimulate the ovaries to produce eggs, usually more than you would in a natural cycle. And then there's the harvesting, which is to retrieve the oocytes. There's the fertilization part, which is done in the lab. And then there's the replacement part, which is to replace the embryo that is created from the fertilization process back into the uterus. And then after that, to see whether or not to support the pregnancy, any pregnancy that occurs. And then from there on, once she's pregnant, then it's just pregnancy management. Yeah. So the stimulation part usually involves medication, and there are a variety of medicines that can be used. Most of the time it involves injections, and the aim is to produce a good number of follicles, and so that we can harvest enough of them to make the process viable. Right? Along the way, the woman would have to go through a series of ultrasound to see whether the medication is working well enough for her. Then at some point in time there'll be a trigger to mature the egg before the harvesting occurs. Then harvesting usually occurs it's a medical procedure, it's invasive. Usually the lady is given some sedation to help her through, and it's harvested usually transvaginally through a needle, or transabdominally sometimes. And then the oocytes are handed to the embryologist, who then do the fertilization part. And then after fertilization, the embryos are graded, and then the best embryos will be replaced after a certain lapse of time, and the remainder will be frozen. Okay, and those that are replaced, the patient will have to come back for the what we call the ET, embryo transfer. And that's a relatively painless procedure, and done as outpatient. Then after, it's just watching and waiting to see whether the pregnancy ensues. Okay?
So there are many steps there. I mean, what has...
Many steps and many protocols.
Yeah, so are there any side effects, or are there things that women have complained about?
So there's no free lunch. I think that if you go for a procedure, there's always something. So the one big danger to women is hyperstimulation. So because each individual response is variable, we're not sure how the woman is going to respond to the drugs. And what we're worried about is that she overproduces follicles. And this can be life-threatening, medically dangerous. It is a reportable incident to ministry. So the idea is to get a controlled stimulation to get the appropriate number of eggs without going into hyperstimulation. So hyperstimulation is one of the biggest problems in the stimulation process. Other than that, there is the usual procedure-related risks of invasive procedures, of maybe anesthesia, etc. So bleeding, infection during the retrieval process. Then in the replacement process, when she gets pregnant, then there's the issues of multiple pregnancy. So multiple pregnancy complications, about 20 to 30% of IVF pregnancies result in multiple pregnancy. This can be mitigated through a variety of means, but still overall worldwide, it's still about 10 times higher than the natural twinning or multifetal pregnancy rate. And then there is a rare condition called heterotopic pregnancy, where one embryo is developing in the uterus in a normal way, and the one is ectopic. Yeah, so those rates increase in women who have ever had IVF. If they get pregnant, then it's a whole different ballgame, because the relative risk of placenta previa, that's low-lying placenta, of C-sections, of preeclampsia, which is high blood pressure during pregnancy, etc., all increase about 2 to 3 times over the age-adjusted risk for a non-IVF patient. And the children, the babies themselves, are at risk also, about 2 to 3 times higher risk of preterm birth, low birth weight, ICU care, and there's about 1.3 relative risk, which is about 30% higher risk of birth defects as well. So that's the big picture, yeah. Okay.
Thanks so much. Yeah, I mean, in your opinion, or I mean, medically, right? What are we usually taught about the advantages of IVF, actually, to give a balanced side?
Okay, so from a purely scientific point of view, IVF bypasses the issues of having problems with tubes. So tubal damage, tubal blockage, impediments to natural fertilization. So IVF bypasses that because you don't need the tubes, right? It also bypasses the issues of men with very poor sperm counts or quality, because you can do what we call ICSI or ICSI, which is essentially taking one single spermatozoa and injecting it directly into the egg or the oocyte to achieve a fertilization. So even if you've got negligible sperm counts, you can still achieve a fertilization to some extent. Yeah. So from a scientific point of view, it bypasses a lot of, because fertilization is assured, more or less, compared to natural pregnancy, where you're not sure whether conception is going to take place at all. So you're one step ahead of the rest of the ART, the assisted reproduction techniques that are available.
Okay, yeah. Thanks so much for sharing about this. So maybe I'll turn to Father David now for a while. So what would you tell us about the Church's teaching on IVF, about morality and the morality of actually maybe even the various steps involved? We've heard from Dr. Douglas.
I think from the moral point of view, the first question is whether bringing people into the world is a moral issue, because there are many ways of bringing people into the world. And we can think, for example, cloning could be one of them. And there is a universal ban on cloning. So it means that people have this sense that not every way of bringing a human being into the world seems to be ethical. There are other more traditional ways, like, for example, adultery. And most people will think that it's not a right way to bring someone into the world. Or even having children out of wedlock, or once again with someone who is not your spouse. Many people will think that that's not a very responsible way of bringing people into the world. So the point is, or imagine, for example, today we have the technology that a government can say, okay, we need 2 more million people. Why don't we just get practical about this, and we get 2 million eggs, and we get 2 million sperm donors, and we just make 2 million IVF babies, and we just hire some people to carry out these pregnancies. I suppose most people will have moral reservations about these cases, which raises the first point. Where do you draw the line? Why do we consider these cases not acceptable from the moral point of view? And that's a question that I don't see discussing. Nobody is talking about that, and nobody is saying why would I think that is an unethical way. So for the Church, there are a few concerns regarding moral reservations regarding IVF. Probably the most serious one will be discarded embryos. That not all the embryos that are created are being implanted, and therefore the remnant of the embryos will have to be discarded. And I have, in my practice, I heard of some women who come asking the question, now it's too late for me to implant the embryos, what do I do with them? And the answer is, it's too late to make any any ethical decision about that. And perhaps these things should have been discussed before people go through IVF. Of course, you still have you can escape that problem by simply implanting only the number of eggs that you only fertilize the number of eggs that you plan to implant, and that will solve the problem of discarded embryos. So the next question would be, in these cases, could there still be something unethical about IVF? And from the point of view of the church, married couples have the right to be parents exclusively from each other. And what IVF does is, let me put it in this way. IVF is not a therapy. It's not even assistive, or it's not a technology that assists. In the eyes, not in the eyes of the church, but in the eyes of common sense, it is a technology that substitutes. That is, there is no debate about that. The technician takes the materials, genetic materials from the spouses, if they are married, and he, so to speak, makes the baby. It is not the couple who makes the baby. So that's a serious moral issue. If you consider that people should be created only, as the church believes, that people should only be created by the act of love, the sexual act of love of their parents, then of course IVF violates that principle, because it is not an action of the parents, it is an action of some stranger who is not part of the couple. But still, you could, if you want, you could be still more picky about that, and you can say, what if the couple themselves are experts in IVF and they are doctors and they don't have any other assistant and they do it by themselves? An IVF that has no spare embryos and has no intervention of other person outside the couple. So the third reservation is that people should be made, or should be, as we say in the creed of the church, we say that the Son of God was begotten, not made. And there is a difference between making things and begetting living things. So only living things can beget another thing and another member of their species. And that's the relationship, that we cannot make people. We make things, and things are by definition of lower dignity than we are. We have an idea of what we want to make in our minds. We manipulate matter. If we want to make a table, that is what we do. So the table was in our minds, and hopefully if we are very skillful, then the table comes out exactly, or more or less, as something that we have previously in our minds. So what we have done, what we have made, is an object, and people are not objects. And it is a totally different way of bringing things into the world than begetting. Even animals beget. They don't have a mind. They cannot figure out what they don't even know what they are doing. But they are begetting something that is equal to their own nature. And that is why this way of bringing people into the world mimics more making than begetting. It is not an action of the bodies. It is an action of the mind that manipulates matter, puts matter together, and voila, you have made a human embryo practically. So all these reservations, once again, and the most important one is that children have the right to be begotten from the sexual act of love of their parents. I know that this is not easy to see, but perhaps to have a better picture of this, the actions of a technician, to see that it is really making and not begetting, they're not that sophisticated. I don't know if I have a coffee maker in my kitchen, right? So it does many things. It has to grind the coffee beans. You have to boil the water. You have to put the vapor through the pressed ground beans, and voila, after a few seconds you have your coffee ready made. So that's pretty sophisticated in my humble opinion, right? So we could imagine that it is not, I think, impossible to make a machine that makes IVF babies. It's not impossible, so it is a thought experiment, right? Because I insist, the actions that are entailed, the physical actions that are entailed, are not that sophisticated. So, and today with AI and all this, we could eventually have a machine like that. Not that we are going to have, or I advocate for that, but imagine that this machine exists and it's creating IVF babies. One day you have to tell your the person who was creating that way, that machine made you. Doesn't that create an ethical concern in people? And that's exactly what the church says, that the children have the right to be begotten from the act of love of their parents, and not from technical actions of strangers. So I wanted to ask Dr. Douglas, usually in Singapore, what is the legislation as to how many embryos can or should be implanted?
Well, legally we're allowed to put up to 3. Most of the time we put 1 or 2. Yeah, it depends on the grade of the embryo and the parents' wishes. Yeah, but generally we would try to avoid multiple pregnancies. So 1 would be a good one. Yeah.
But how many embryos are actually taken up for fertilization?
Oocytes. It depends on the stimulation. So if you have an uncontrolled stimulation, you could take up many tens of oocytes, and a lot of these will then have to be fertilized, because you never know whether what you take out will fertilize, and if you fertilize, whether it will then progress on to 2-cell, 4-cell, 8-cell blastocyst stage. So usually the aim is to start with more, so that at the end there will be attrition along the way. So you will still have a relatively good number of good embryos.
How many eggs would be fertilized then?
Oh, it varies. It depends very much on age of the mother, the quality of the eggs, her egg reserve, things like that, and then the quality of the sperm. So there are many variables. But the general principle is, if you have more, give me more so I can work with more materials and hopefully give you some. Because what you're worried about, or what the IVF people are worried about, is that you come up with no embryos to implant. So you could fail at every stage. You could fail at stimulation, you could fail at retrieval. At retrieval, we suck out all the follicles, and everyone is empty, and you realize that there's no oocytes. And then if you do have oocytes, then poor quality oocytes don't fertilize, poor quality embryos don't progress. Yeah. So the younger women do a lot better. Yeah, so 35, 37, which is why currently we allow legislation to women.
You fertilize 37, 30?
Oh, for egg, so egg freezing. So for example, egg freezing works best for women under 37. So generally 37, 35 in different countries is a good cutoff. Yeah. But there are other parameters we use to determine the success rate of IVF. Yeah.
So 2 questions, but I think first one, so how do you choose which eggs do you then implant?
Actually, I don't do IVF.
yeah, not you, sorry. I mean, in general, what are the guidelines on like how do you choose?
Oh, the grading systems. It's very much like your diamonds. Yeah, so you take out the better diamonds and you grade them. And of course, you want to put the fresh embryos, the best ones first, and you leave the poorer quality ones for last, because sometimes the parents don't need the poorer quality embryos after they've had success in 1 or 2 pregnancies already.
So what's done with all those embryos that are not used?
Frozen. And they can be stored indefinitely. 10 years is a good. So the problem in a lot of countries, like there are hundreds of thousands of frozen embryos in the US, in Israel, and nobody knows what to do with them, because sometimes the parents don't come back. They don't pay for storage renewals, and the institutions are wary of discarding the embryos, because the parents may come back one day and say, "What happened to you? Why didn't you contact me? Where are my embryos?" And then you face a lawsuit. So a lot of embryos are in limbo. Yeah, and for parents where they have too many, sometimes you may have a dozen embryos still in freeze, and you've already had 2 children or 3 children, and then you don't know what to do with the rest. So then you can give instructions that you don't pay for storage anymore and they're to be discarded. And discarded means basically terminated.
So, Father, what are your thoughts, or what is the Church's stand on these embryos? I mean, are they considered alive?
Well, I think there is no doubt about that. They are certainly alive, if they are alive. So the Church doesn't have the monopoly of guessing what is alive and what is not. I think for most things, everybody can assess what is alive and what is not. Okay, in very general terms. So basically, these embryos are certainly alive. They are human beings, exactly like everybody else. And perhaps it is good to notice that we are only talking about the morality of the conception, the way they were conceived. We are not talking about the dignity of these people. They have exactly. We are all equal in dignity, regardless how we were conceived, which is another thing. Many people ask, so what do we do with them? As if they were, I don't know, people from other planets. We don't go around asking people, how were you conceived? Okay. And I think we don't go around asking our parents how we were conceived. I think that's how we were conceived is a business between God and them, and it's better sometimes not to know. And IVF is just a way of conceiving people, so it doesn't affect on how, and should not affect how we deal with people, whether they were conceived through IVF or not. Yeah.
So, Father, I mean, we've heard much about the process and all that from Dr. Douglas. Do you think there would be any way that IVF can be made morally acceptable then, or is it acceptable in certain situations?
So the problem with IVF is that it's not technological enough, or rather, that the so-called therapies that we have today are not real therapies. So if you are subfertile, you don't come out of these procedures being fertile. You are just as infertile as you were. So these are not assistive reproductive technologies. I think they should be called substitutive reproductive technologies, because they substitute the parents. And that's what is lacking. We don't have technology, or very few technologies, that really help the sexual act to be fertile. And since IVF bypasses totally the sexual act, it is simply not acceptable because of that condition. But once again, it's not that the Church is against, or ethics is against technology. The problem is not that we have technology. The problem is that we don't have good technology. We don't have enough technology to assist parents and help them to make their sexual acts fertile. We don't have enough technologies for that. So it's a matter of people getting smarter and more creative and creating technologies that really assist the couple to have a child, rather than substitute the couple in having a child.
So, Dr. Douglas, I'm going to come back to you and just ask you maybe, what are the alternatives to IVF, like as Father says, to actually assist these couples in having a child?
Okay, in the fertility pathway, there are only 4 steps. So the first is you achieve it naturally. You achieve it through IUI, which is intrauterine insemination. There's IVF, in vitro fertilization, or there's adoption. If you want to be a parent, these are the 4 routes available to you. In the natural way, assuming that the couple is fairly normal, the easiest thing to do is to teach them to recognize the natural signs of fertility. Because 30% of infertile couples or subfertile couples and ovulation, or failure to recognize ovulation, is the problem. So that's one of the biggest groups, ovulation. So teaching them to recognize these signs, and natural family planning, neprotechnology, basically you synchronize your understanding of your system. That's what you're doing. Through observation of cervical mucus, okay? And for some people, additional tools like temperature, which has been discarded because it doesn't tell you in real time what to do. It tells you retrospectively that you did ovulate. But in real time, cervical mucus, the Billings ovulation method, aka natural family planning, or NAPRO, and possibly the use of urine LH, luteinizing hormone ovulation predictors as an adjunct. So these are the natural ways, assuming that the couple is fairly normal. And most couples are fairly normal. Yeah. Of course, if they have other issues, they have pelvic adhesions, scarring internally, the tubes may be kinked, twisted, blocked, not patent, then surgery would be an option. Yeah? Sometimes they have other issues. They may have fibroids, they may have polyps, and these are a hindrance to conception. Then surgery would be one option for them. Yeah? So ideally, the aim is to optimize the couple, the husband, the wife, so that we create the right conditions for natural conception as far as possible. Okay. Some of them have issues with consummation. So that's a relatively smaller area, but it's real. A lot of good Catholic children are brought up not versed in the ways, and sometimes that is necessary. And these are all relatively small impediments. Once you can overcome these impediments and there's nothing really wrong with them, then you can get pregnant. Yeah. It's the group who have real problems, where the really poor sperm counts or poor sperm quality, severe endometriosis with severe pelvic adhesions. Sometimes it's difficult in a natural way. Then you have to figure out whether these couples should go up the steps or accept the subfertility or move on to the adoption route. Yeah. Maybe we'll talk about that later.
Yeah. Actually, I was going to bring it back now actually to either of you actually. So, I mean, in your experiences, how do you all journey with couples? I mean, one, the medical side, and two, the spiritual side. Has any couple come to you to share with you their problems and ask you, what can faith do to offer?
There are many couples, and as I said, either because they have already done IVF and they want to know more about it, or because they are contemplating doing IVF and all that. So how you journey with them, you say that God will judge everybody according to their conscience, not to my conscience. So my role there is not to substitute their conscience. Why? Because we should not be substituted in personal matters, whether it is a sexual act or it is counseling or advising on moral issues. So my role there is to respect the conscience and help them to make a conscientious, responsible decision by giving them the information, by giving them what people think about the morality of these issues, because eventually it is their conscience and their own decisions and their own lives, and I try to respect that as much as possible. But as well, I need to remind them, first of all, that what is my role as a educator in the faith, why the church thinks the way she thinks, and the ultimate decision is on them, of course. Yeah.
Maybe if you don't mind me asking, I'm sure it's on many people's mind. So is IVF considered a mortal sin?
It is a very serious matter, but so for mortal sins you need 3 conditions. It has to be a serious matter. It has to be done with full knowledge and full consent, and so that's where although I think it is a very serious matter, I think many people don't do it with full knowledge of what they are doing in terms of moral assessment, and it is done certainly with consent, because I suppose they have to sign consent form for these things. But once again, whether the conscience is sufficiently informed about this, certainly not in many of the cases. Yeah.
But maybe I'll ask you then, so as a practitioner who does not practice IVF, then how do you counsel these couples who come to you?
So we try our best with the tools that we have available, working in an authentic way to help these couples journey. Along the journey, they should be discerning, to discern the path that is coming ahead of them. We lose some. Some will choose to follow technology and go off and do the IVF. We try and facilitate if their realization is that they can't proceed, they can't achieve their success naturally, they won't do IVF, then we try and facilitate the adoption pathway for them. But along the way, it's always a journey. We walk with our patients. Subfertility is a very deeply painful experience for the parents. I call it the problem of all the S's. S. So a woman who realizes that she's not fertile faces shame and sadness. Shame because she realizes that she's not created, or she's created differently from other people. And sadness because the expectations come crashing down. All the things that you were supposed to have, that people told you were supposed to have, once you got married, to have children, to have as many children as God will give you, can't be done.
And it is personal and social. So
It's very.
Individually, they feel sad, but then the people around them sometimes contribute to make them even sadder or even more shameful. So
that's where the other two S's come in. So there's the S of silence. I can't tell anybody. It's so shameful to tell people. And the S of solitude, because I have to walk this journey with me and my husband, or as a couple, we walk this journey alone. So this is the difficult part. Having come to the realization, this is the human part, that they can't have children, or it's very unlikely that they can have children for whatever reason, because she's too old, because her egg quality is poor, all the other reasons, they journey alone.
Even if they are married, because it is different for men and for women. So even sometimes the husband says, okay, we cannot have children, he doesn't see it as a big deal, but then she does, and therefore they cannot, she's still alone in that suffering, so to speak. So but because the husband doesn't participate in the problem as much as he does, then she feels very much alone in this journey as well. Yes.
That's true. Usually in analysis of subfertile couples, we find that we get better success rates among couples who come together as opposed to just the woman who comes to the clinic by herself. There's a synergy when it's a shared experience. So in their silence and their solitude, I always tell them, move to the next two S's. Speak about it. Share your experience. And then you will realize people come out of the woodwork. C.S. Lewis said, the bond of friendship starts when the other person says, oh, you have that too? So do I. And then you start this friendship. So sharing, speaking about it, gives you liberation. You feel that you're not alone. I've got friends, we can share with each other and we can become a community. And we help other people who are also journeying in solitude. And there comes your strength. So you turn your solitude and sorrow into a strength. And then, of course, you go back to Scripture and the saints, and you put yourself before them. I mean, I think the realization sometimes is, Scripture doesn't tell you you will have children. Scripture tells you He will always love you. He will always be faithful to you. Right? And His grace will be sufficient for you. But it never says that He promises you to have children. So once you overcome that side where you have now accepted this new direction that you have, then that's where your strength comes in. So really it's all the S's that come into this.
Thank you. Yeah. Having more promises come in after that.
Exactly.
Right? Yeah.
And we never say never. I mean, you're a doctor, you know, we never say never. And I've had patients where the sperm count is 100, right? Normally it's 50 million, 100 million, right? And he's got 100 sperm. or they've been told that the tubes are so badly damaged she would never get pregnant. One patient called me and said, do you know XYZ hospital wrote me off. They told me, don't come back. After 3 cycles, they told me, we can't stimulate, you've got no eggs, don't come back. So I said, come back. And 2 months later, she was pregnant. Okay? Miracles happen. And things heal. Even if your tubes are damaged, maybe over time, somewhere along the way, something has healed. And it's possible again. But you shouldn't lose your faith in this journey. Okay? Despite everything that's been put before you, if you turn to the last 2 S, your scripture and your saints, you may just get lucky. You see? Yeah.
So the image I had when you're describing that is like all these blocked tubes, right? Then even if it's just a small hole, like really the eye of a needle opens up, and that's sufficient enough, right?
Exactly.
Yeah. So even faith as small as a mustard seed can create miracles.
Exactly.
Yeah. So thanks for sharing. Just one final question before we end off, and I think this is also a message to many others, especially in these times, who are IVF babies themselves, right? So what does the church say to them? You know, some may carry with them shame, some pride, they wear it as a badge of honor, but you know, in all of this, what is the church's message to these children actually, or even young adults? From either of you, I would say.
As I said, that's a question that we don't need to know, okay, how we were conceived. But if you happen to know that you have been conceived through IVF, I think that speaks about how much you were wanted, okay, that your parents went through all this effort and all these troubles, because it is very troublesome. So that speaks of an act of love for your parents, to try to do it through IVF. And the second question is that you have the same. We are all equal in dignity, and no matter how you were conceived, you enjoy the same dignity of every human being, and God loves you the way you were created, and that's what matters most in life.
Thank you. Anything to add?
No, I think Father is very spiritual, very spiritually directed.
Yeah, I think he wrapped it up very nicely. And so yeah, I also want to thank everyone for joining us as well. We'll probably be leaving the links for the NFP, the Natural Family Planning Program, as well as NAPRO, the Natural Reproductive Technologies, in our description for this video. But otherwise, yeah, really thank you everyone for joining us, and we hope to see you again for the next podcast. God bless and have a blessed day ahead.
Thank
you.
Thank you.
Thank you, Father.
Thank you.